The fourth case of monkeypox in India has been confirmed in Delhi. While the three earlier cases, all in Kerala, had been detected in individuals who had arrived from the UAE, the Delhi case has no history of international travel. The World Health Organization has sounded its highest level of alert for monkeypox and declared the virus as a public health emergency of international concern. The disease is endemic in regions like West and Central Africa, but cases have started to spread due to zero restrictions on international travel. According to the WHO, monkeypox is not as contagious as smallpox and does not cause severe illness. So along with COVID, is this a new public health concern for India? How do we tackle it, protect ourselves, and watch out for this virus? Is it time for us to think about a vaccine to protect the population? To answer all these questions, I am being joined by Dr. Gagandeep Kang. Dr. Kang, really appreciate your time. 4 reported cases of monkeypox in India now. How serious is the threat, as WHO too has declared it a global emergency? Do you feel there could be many more cases in the country, even as we speak?
It's very feasible that there are more cases than have been counted so far, because India is a country that is connected to many other places. It's also possible, based on the latest case in Delhi, that we have person-to-person transmission taking place within the country. However, I don't think that this is need to panic at all, because this is a virus that can be much more easily handled than SARS-CoV-2. It's a virus that does not spread as easily as SARS-CoV-2 does. It's self-limiting. It tends not to cause fatal illness. It can be very painful, very uncomfortable to have a monkeypox infection, but it does not lead to the numbers in terms of fatality as we saw with SARS-CoV-2. Neither infections nor the deaths are likely to be anything like what we had seen before. There are about 16,000 cases that have been reported outside of Africa, and so far only 5 deaths. Most of the deaths occur in people who are immunocompromised for one reason or the other. So this is the time for expanding testing, for educating people, including healthcare staff, in how to recognize cases of monkeypox, maintaining a high index of suspicion, and then when cases are identified, following up to ensure that there is good contact tracing and good isolation until the lesions heal or until the incubation period is over.
Dr. Kang, unlike 3 previous cases in India, the case that has been detected in Delhi has no travel history. What really explains this infection, and if we should be concerned about it?
Well, anytime you have an infection where you don't know who the person who got infected acquired it from, it requires that there be intensified efforts to identify the source of infection. This is important when the numbers are low and you want to restrict the disease as much as possible. Now, if this individual has attended a party in Manali, then the right thing to do is to make sure that we try to identify all the people who were at that party, people that were traveling companions, and see if any of them might potentially have either transmitted the infection to this individual or acquired an infection from the same person from whom this individual acquired his infection. So it's concerning, but it's not something that is not handleable at the moment.
So then, is there a risk of outbreak like one we had with the COVID infection? And can this infection be managed clinically? Because in case of COVID-19, WHO had famously said that we were in an uncharted territory. With monkeypox, is there a threat of an uncharted territory?
Well, we know a lot more about the pox viruses because we've dealt with smallpox and related orthopox viruses. We also have a history of having dealt with outbreaks of monkeypox for over 50 years. This is a virus that does not mutate like the SARS-CoV virus did, so we don't expect to see large numbers of variants. We may see classes or lineages of different monkeypox viruses that might have different symptoms or different case fatality rates. That's known already. But we don't expect for the virus behavior to change significantly. This virus does not spread as easily as SARS-CoV-2. It requires intimate contact, and if it is through the respiratory route, you need to be very, very close to the person who is infected and infectious in order to acquire the infection. So spread is not as fast or as frequent as has been seen with SARS-CoV-2. So we should not expect the numbers to be anything like what we have seen before. And in terms of the healthcare system being able to handle it, this is a virus where you can get fever, you can get joint pains, the pain can be quite severe. And then you have the skin lesions, which if they are on the mucosal surfaces, the mouth, the rectum, that can be hugely painful, but they heal by themselves. If you're not immunocompromised, the lesions will heal by themselves. So the only support that is required is symptomatic support. There are vaccines, there are drugs that are available in other parts of the world. Most of them are not available in India. But people who have been vaccinated against smallpox will have some level of protection against this virus as well.
Dr. Kang, thank you for sounding so positive, but I have more questions for you. What to look out for in one's body in case one has to be vigilant to this infection, and what are the symptoms to see if one is infected?
So the first things that happen, the incubation period, one, you have to be exposed, and the incubation period is between 1 and 2 weeks. Can be a little bit shorter, can be a little bit longer, but generally 1 to 2 weeks. After that, the presenting symptoms are usually respiratory or fever, and then that is accompanied by a rash. The rash then becomes like little vesicles, like little blisters on the skin. And anytime you have fever and a rash, that's the time to maintain a high index of suspicion and go and get yourself tested. The rash, when it proceeds to the blisters or the vesicles, can also proceed to pustules or solid, where essentially the fluid that is inside is more like pus, much thicker. And after that, the lesion tends to dry up and scab over and fall off. So until you get new skin that is formed under the lesion, you are potentially still infectious to others and should isolate yourself.